actually started as a complete ban. And while I think that that's probably the best policy, I understand that we work in two bodies at the legislature. We work with the House and the Senate. And I appreciate the input I've received from the House. I appreciate the input I've received from some of your colleagues in negotiating this bill. I've had a lot opportunity to do that. And I know that your colleagues are sincere in some of their concerns. And one of those concerns was we've got to find a way to be able to purchase pure kratom leaf and nothing else. And we're going to talk about what pure kratom leaf is and what it's not. I know there's going to be an effort as this bill, assuming this bill moves forward, I hope it does. There's going to be an effort to continue to amend this bill and to include extracts. And I want you to pay close attention to what extracts are. We've got Dr. Forsyth here, and he's going to be able to talk about what extracts are and help you understand why that would be very, very concerning to put that back in the bill if this moves forward. But I do have a third substitute. That third substitute came from some of the concerns, not concerns from DPS, but it's drafting. It's a drafting issue. And the other thing the third substitute does, it's clear in the language that people who possess the pure kratom leaf don't get prosecuted. So I want to make sure that we move that third substitute at some point. And it also repeals the title Kratom Protection Act. But I'm happy to move forward with the third substitute now, or I'll follow your lead, Mr. Chair.
We'll get to it.
Okay. So let me just tell you what the bill does, and then I'll move on to the presentation. We are allowing pure kratom leaf only to be sold in the state of Utah. Everything else would no longer be allowed. They would be sold in retail tobacco specialty stores. We would have provisions that relate to penalties and fees. Penalties up to $5,000. We bump the age up to 21, and all of the language that you saw in Senator Vickers dealing with 7-hydroxy, we have included that. I've had a chance to work with Representative Daley Provo, Senator Vickers, and we've been incorporating this language. But for the presentation today, I wanted to include some folks with me to talk about their experience. I've asked Kelly Pearson to come speak. I know he has an opportunity to do that from the Department of Ag, and then we'll go to Dr. Forsyth. And I do have a few other folks that want to speak, and I know your time is limited and it's late in the day.
Go ahead, Kelly.
Yeah, my name is Kelly Pearson. I'm the Commissioner of Agriculture for the state of Utah. And I can tell you right now that I fully support the ban of kratom. Kratom is something that keeps me up at night as the regulatory division that we have to do for kratom. But I'll tell you why. I get asked all the time, well, you oversee hemp and cannabis. Why doesn't that keep you up at night? Well, they are there's science behind those. They have a controlled area like pharmacies. Kratom is what's getting to our kids. It's at gas stations. There is no science behind it. Every time the lobbyist firms come to our division, which they've been there 10 to 15 times, trying to tell us, kratom is safe. Kratom can be mixed with kava. You ask, where is the science? And not one of them can provide it. It's so new. So I appreciate the sponsor and what he's done. The day that we tried to do some rules to restrict the kratom kava, the agency was sued for $8.1 million, saying that we are hurting their industry. So that's what we're dealing with. So I appreciate this bill. I hope that you will support it. We have one employee right now that goes around and regulates kratom. So that tells you what we're battling. There's other bills this session that rely on us getting funding to go over and regulate it. But I just want to tell you that that's what keeps me up at night, is regulating kratom, because it's new, because there's no science. So thank you.
Before I go to Dr. Forsyth, Mr. Chair, do you have any questions for Mr. Pearson with our Department of Ag? I'd hate to have him go down because I've got a few other folks that I'm going to bring up. I've asked everybody to be brief, but I'd hate for him to miss his opportunity. Obviously, you can call him back, but.
All right, I'm not seeing any questions.
So let me introduce Dr. Forsyth. Dr. Forsyth works with our Utah State Lab, and he's going to provide his own testimony. But I also asked him, because I anticipate an effort to claim that extracts are pure kratom, I've also asked him to address that issue today. And following Dr. Forsyth, I'm going to invite Megan Brockenmeyer up from our drug overdose prevention research and look at the state numbers, see what we're actually learning about kratom in the state of Utah.
I'm Dr. Brandon Forsyth. I'm director of the UDAF laboratory as well as the specialized products division that regulates kratom. So today and probably through the session, you might have heard from kratom advocates who talk about kratom as though it's a miracle drug that cures chronic pain or opiate and alcohol addiction. And I do feel for individuals who are using kratom for that purpose. I would hate to take away an effective treatment option from these individuals. Unfortunately, that isn't the whole story about kratom. I've been directly involved with the regulation of kratom for a few years now, and the most popular products that we see out in the marketplace are extracts and concentrates, sometimes compounded with other substances like kava. They are marketed as energy supplements, and in some cases as very thinly veiled alternatives to opium, flat out. These high potency products can contain 300 to 500 milligrams of metragenine in a single shot, a single dose of this material. And that's compared to about 5 to 10 milligrams of metragenine that is typically contained in one of these little half-gram capsules that you might see out in the marketplace. That means you're going to need to take 60 to 100 of those little capsules to get the same dose of metragenine that you would get in one of these shots. And kratom advocates might argue that this is a benefit because metragenine is the safe kratom alkaloid. And they're going to point the finger at 7-hydroxy and synthetic kratom alkaloids like pseudoindoxil or MGM-15. But our department has already taken action on these products and they cannot be legally sold in the state of Utah. They might be present in the state if people are buying them online, but they're not legal for sale. These products that we hear heartbreaking stories of addiction and death about are concentrates that mostly just contain metragenine. And there are two big reasons for this. One, our own bodies convert metragenine to the more addictive and dangerous 7-hydroxymetragenine and pseudoindoxil. And this is according to peer-reviewed studies published in the ACS Pharmacology and Translational Science Journal just a few years ago. And this work was funded by the NIH. The more metragenine a product contains, the higher the dose of 7-hydroxy and pseudoindoxil the user will experience, effectively activating their opioid receptors in their body, just like heroin or another opiate. Number two, kratom alkaloids are potent inhibitors of major liver enzymes like CYP2D6 and CYP3A4. Products that contain large amounts of metragenine compromise our liver's ability to metabolize other drugs, potentially leading to overdose deaths when taken with otherwise safe doses of drugs like diphenhydramine, or as it's more commonly known, Benadryl. Who hasn't taken some Benadryl? I still have concerns with kratom leaf, to be clear. I don't necessarily like that it's being sold to consumers, as there's still some potential for harm there. But if that's a compromise that can provide relief to chronic pain users or people seeking relief from addiction, I think we can manage those risks much better than we can manage the risks from extracts and concentrates. And I'll conclude there.
Yeah, thank you. I do have a question. So you're saying that the concentrated metragenine is can be, if I understood you correctly, can be just as bad or addictive as the 7-hydroxymetragenine?
Yes, because it can be converted by your body into 7-hydroxy. Your liver metabolizes it to 7-hydroxy and then to pseudoindoxil, which is even more potent.
Okay, thank you.
And he referenced actual research. I have the research here too. And this is just Columbia University. It's important to point out that the more, this safe kratom, this safe pure kratom that you take, your body, I mean, again, it's important to emphasize this, your body metabolizes into 7-OH. And this idea that the industry is going to remove the 7-OH on the front end to keep it safe is not accurate. That's not what happens when you take high doses of extracted kratom. Your body metabolizes 7-OH, and that's the exact science. I just want to emphasize that, Mr. Chair, because that's an important point. I know that there's a push to say we're going to take care of 7-OH on the front end. It's horrible. It is horrible. But if you take large quantities of kratom, your body is going to produce it on its own, and that's the important point.
Thank you. All right. Does that conclude your presentation?
I actually have Megan from DHHS Drug Overdose Prevention Research. Megan has done a lot of research about deaths in the state of Utah, and I asked her to come and speak to this bill. And after that, I've got just one gentleman who's online, Tim Miller, if you can look for him, and he's going to provide a statement as part of the presentation. And then I'll just wrap up with some comments.
Okay, go ahead, Megan.
Hi, good afternoon. My name is Megan Brockmeyer. I'm the Drug Overdose Fatality Examiner in the Department of Health and Human Services Office of the Medical Examiner. And as mentioned, I'm here to provide information or epidemiology around kratom-involved deaths in our state. So one of the most important pieces of information that our physicians who are especially trained in forensic pathology use in investigating and determining a drug toxicity death is postmortem toxicology. And one of the things that we're looking for when in this toxicology testing is for metabolites or components of kratom called metragenine and 7-hydroxymetragenine. So when I talk about the deaths, we are talking about deaths that have involved those metabolites or components. So in Utah, there have been no kratom-involved deaths prior to 2014, but since that time, we have seen a steady increase in the number of deaths involving kratom. The number of deaths peaked in 2023 at 40 deaths, though in 2025, our data is still incomplete, but we are still on track to exceed or match the highest number on record for kratom-involved deaths. So just to stay consistent with presentations that I've provided in other committees, I just want to kind of highlight a specific 5-year period. So between July 2021 and June 2025, we saw a 43% increase in the number of deaths across this time period. There was a total of 158 deaths during that 5-year period. The majority of these deaths, were ruled as accidental. And then there were fewer deaths that were intentional or suicides, and then also a few deaths where the manner of death was undetermined. So just to look at a few demographics to give you an idea of who is dying, we do see that males account for over 2/3 of kratom-involved overdose deaths, It's higher than than what we see in general drug overdoses. Also, people are dying from kratom-involved overdoses about 4 or 5 years younger than people are dying from overdoses from another substance. We have seen kratom-involved overdoses in most areas of the state. Some of the highest rates in our area, in our state, are in the Tri-County Health District, Southwest Health District, and Weber Morgan. And then we also have higher rates in Salt Lake and Utah counties. So the majority of overdoses involving kratom also have multiple substances. So on average, there are 4 drugs involved in a kratom-involved overdose. And this just means either that the combination of these drugs caused death. We also have seen kratom-only deaths. While that number is lower, we have seen an increase in the number of deaths involving only kratom. In fact, 50% of kratom-only deaths have occurred in 2024 and 2025. And then just for a little bit more information, fentanyl is the most common drug that we see alongside kratom. That's it for me.
Okay. My last presenter, he should be online, Tim Miller. I'm going to let him make a statement. Tim actually sold some products that are manufactured in Utah, a product called Feel Free. Hopefully he's online. If not, I'll wrap up with a statement and then open up for questions.
Okay, Tim, go ahead and turn your camera on and let us introduce yourself and let us know your location.
Do we see him online?
Tim, you need to go ahead and join.
Can you guys hear me?
We can hear you. Tim, go ahead and introduce yourself and let us know your location.
Oh, my name's Tim Miller. I currently live in Virginia. As a former Kratom addict, I want to say I'm in favor of this bill, and I'd like to testify to two things today. One being my addiction to a very popular Kratom and Kava drink called Feel Free that's made by Botanic Tonics. And two, my sales training while working at Botanic Tonics. This Kratom Kava drink was originally presented to me in 2023 as a healthy alternative to energy drinks because it was all natural. When I took it, I felt amazing, and I felt so good that I decided to apply for a sales job in the company. I quickly found myself increasing from 1 bottle a day to 4 to 6. I eventually was dependent and was taking over 20 bottles a day. My life rapidly fell apart. So in May of 2025, I reached out for help. I had a doctor who treated me like an opiate addict and prescribed me 9 different medications to help with the withdrawals. The withdrawals were an absolute nightmare, just to say the least. It took me 10 days just to be able to get out of bed, and it took me about a month before I was able to get back to work. But I don't know if I'll ever get back to normal. I struggle with the aftermath of this addiction to this very day. It has affected me and my family in ways I can't describe to you. I worked at Botanic Tonics in sales for almost 2 years. When I first started, I had no idea how addictive this was, and also decided to share it with my wife at some point. She became an addict just like myself, and this product nearly destroyed our lives. There are 2 things that were beaten into my head when I worked in sales for Botanic Tonics. First was that the average customer buys 6 bottles a day. Keep in mind, they're about $10 a piece. This bottle warns you should only take 1 a day. But everyone knew that once you got people started, they wouldn't stop or couldn't stop and would steadily increase their dose. They encouraged me to give out free samples at every stop I made, up 6 bottles per store, and I was visiting 150 stores a month, sometimes multiple visits to that store. The other things they beat into my head were to emphasize how Feel Free was much like an all-natural alternative to 5-Hour Energy. I rarely use the word Kratom when presenting this product. I was told to present it as a Kava forward product. And in my opinion, the company knows exactly what they're doing. And I believe the same is true for most other Kratom companies. I believe it is wrong, and people need to know the truth about this stuff. Thank you.
Thank you, Tim. It looks like we have a question from Representative Roberts. Okay, never mind. No questions. Thank you, Tim.
Thank you.
Let me just wrap up by thanking this committee for hearing this bill. We've heard a lot about Kratom this session. I appreciate the work that has happened with Representative Daley Provo, Senator Vickers, Representative Bolander. We've met regularly. We've met with the Department of Ag. We've tried to craft a bill that respected those folks that want to use pure Kratom leaf. While I started with a ban, while my hope is that we would do a full ban, that's where the bill is today with a regulatory structure. I think it's important to point out that in this language, the Department of Ag is going to have those resources to be in those tobacco shops to make sure this is done appropriately. I just want to end with a statement from the United States Navy and the United States Marines. The Department of Defense, under the Secretary of Defense, banned Kratom for those folks, but this is a statement that came out right before we came into session, and it was a ban for our United States Navy and our United States Marines. Kratom metrogeny, 7-hydroxymetrogeny use poses significant health risks, including seizures, tachycardia, hypotoxicity, hypertension, and death. Several countries and states have classified kratom as a controlled substance to its high potential for misuse. The Drug Enforcement Agency classified kratom as a drug and chemical of concern. Effective immediately, sailors and Marines are prohibited from engaging in the use, possession, distribution, and/or manufacture of any substance, product, compound, or item containing or derived from kratom, including but not limited to metragedy and 7-hydroxy. With that, I'm open for questions.
Okay, thank you. We'll take this to the committee for clarifying questions. Representative Roberts.
For the hard work on this, and we've seen a couple of these bills already. So I'm trying to get my head around. Does the extract?
Yeah.
It converts. It sounds like it converts. Your body metabolizes it into 7-OH. Does it do it at the same level of toxicity? Like, is it as bad as regular old 7-OH?
Can I phone a friend and have Dr. Forsyth come and answer that?
please.
Thank you. It's the same compound. It's exact like the chemical structures. Your body doesn't know the difference between the two.
Okay. So it has the same impact. Functionally,
Exactly.
it is the same thing.
Correct.
Okay. And then I know we've gone back and forth with the different bills on the regulatory structure or in, which product we're going to regulate and which one we aren't. Is there precedent with other states in how we're doing it in your bill? Like, do other states ban the leaf keep the leaf regulated, but ban these other two pieces? I'm just trying to get some
Yeah.
context, I guess.
So one of the votes that I regret was in 2019 when we voted for the Kratom Protection Act. We passed it here, 34 plus states went and passed it out in the country. Then a bunch of states started to ban it, and there is a patchwork of regulation right now. Iowa's trying to ban it. Ohio's trying to ban it. Louisiana just did a ban, but I think ours will be a little bit unique in between where we really scaled it back. I know the bill in Virginia said you can't have more than 1% 7-OH. I think they're missing the science that Dr. Forsyth just talked about. I think it's important to get those extracts and get that down as much as possible. But it's a patchwork right now. There was a time that states were passing the Kratom Protection Act. Now states have seen the damage, the devastation, and they're going backwards on that. And unfortunately, we were kind of ground zero. It kind of started here, and I think it needs to stop here.
The last question, Mr. Vice Chair. So does the leaf, you regulate the leaf, does it just get regulated at the RTSBs, or where can you legally sell and distribute the leaf?
Let me pull up the Department of Ag because they're going to
Okay.
be part of that regulatory structure. So maybe Kelly, can I ask you to kind of respond to that one? Or both, either.
Yeah, I'll respond to it. Yeah, the intention is to only have it available at our TSBs.
What stops us? What I worry about, we go through the regulated channel, but it somehow ends up in a vape shop and they got a box in the back and, the kids know that they're selling it. How do we enforce it so that it doesn't just get submerged into the black market via the vape shops that aren't the RTSBs?
It's certainly going to be available in the black market. It's available enough in the United States and all over the world that it's going to be impossible to root out at this point. It's a natural product. It comes from
Can you bring
leaf.
your mic a little closer? Thank you.
Pardon. It's going to be out there. And so the most we can do, I think, at this point is prevent companies from marketing to individuals who are at most risk of becoming addicted to it. And that means getting it out of common retail places, at least at RTSBs. It's not on brightly colored displays that appeal to children. RTSBs are more used to carding their customers. And so we feel that that's more appropriate. I agree, it's not an ideal solution. I would still like to see a complete ban. But as I said during my presentation, I do feel for those individuals who use this to treat chronic pain and addiction. And that's really the only reason I'm on board with the compromise.
Thank
Yeah.
you, Senator, for the hard work.
And let me just say one thing, to your point on the vape shops, I think that's a concern. It's a concern we've shared in the legislature. You've got a person here in the House that's not a committee member, otherwise I'm sure she would say something, but I think the representative to my left has some really good legislation dealing with that issue that I hope that, I think there's a lot of wisdom in passing that and seeing it move forward.
Okay, thank you. Representative Wilcox.
Thank you. My question is for the medical examiner, Megan. I didn't catch your last name. I apologize. Thank you. Can you clarify some of that information you shared with us earlier? You said we have a number of deaths that we can attribute to Kratom alone.
Correct. Yes.
And what does that look like again?
So it's a relatively small number. So it's 9% of all kratom deaths in Utah involve only one drug, kratom. The vast, if I can just say this, if we, took out kratom, most overdoses involve multiple substances.
Right.
So that's not unique to kratom.
No, that's been the case across the board forever. Okay, so make sure I understand. So 9% of all deaths that involve kratom are kratom alone. What is that out of? Can you give me a number? Like, what does 2025 look like?
So, well, 2025 still preliminary, but to date, we've had 41 deaths, which is the highest on record.
That have
in our-
involved kratom confirmed that your
Correct.
office has been able to prove?
Correct.
Okay. Okay, thank you.
Okay, Representative Matthews.
Thank you, Mr. Chair. Wowee, how lucky are we? Got another kratom bill. So you'll have to forgive me. I didn't have an opportunity to read through this whole substitute. I'm not sure when it came on, but could you help me figure out? I know there's a $5,000 fine in here that I see for people that are selling it that aren't supposed to be. Who is inspecting or going? Is this just when like law enforcement reports to? Oh, sorry, Mr. Chair, if I may ask that question. Sorry.
Yeah,
Speak to that.
so we're giving that regulatory authority to the Department of Ag. Right now, they have one employee, and I think what Mr. Pearson said is it's been difficult. I think he's been frustrated. I think it's been 6 years of frustration. The language of the kratom bill that I have, as well as Senator Vickers does have, as well as JDP has some funding attached to it that would help provide some additional resources. They need resources to do this, but the Department of Ag has the expertise in the space right now, and they'd handle the regulatory burden.
So follow-up question, if I may. So is this bill counting on the other kratom bills passing in order to fund the provisions and the mechanisms in this bill?
Yeah, so this bill has taken language from Senator Vickers and his language, kind of the catch-all 7-OH and banning all of those additional alkaloids. So we've worked together, and this is the vehicle that our work group chose to move forward.
Okay, thank you.
Thank you. It appears there are no other questions from the committee. We'll take this. Can you raise your hand if you'd like to speak to this in the public? Looks like we have 1, 2. Keep them up. Let's go 1, 2, 3, 4, 5, 6, 7, 8, 9. I counted 9. How many do we do online? We have 3. So we have 12 that would like to speak to it. We'll do minute and a half each. Let's go ahead and fill up the seats up there if you're here. And then if you'd like to speak, yeah, go ahead and fill up. We're giving you a minute and a half each, and we'll get it started. Go ahead.
Yeah, my name is Spencer Hansen. I'm an addiction psychiatrist. And over the last 4 years in my outpatient clinic, I've learned a lot about kratom from people who use it. They come in and ask for help to get off of it. And so after talking to them over the last 4 years, I've learned that it works very similar to fentanyl and heroin. And by and large, most of the treatment choices that we use to get them off kratom are with medications that we use for fentanyl use disorder and heroin use disorder. And it's a significant burden on the body and the brain. And it's a procedure that lasts quite a few months, if not a few years. My latest case is a mother of 5, marathon runner, very strong runner, just ran the Boston Marathon last year. She says this has really kicked her butt. And she came in asking for help to get off the product. I probably just finished with my clinical opinion that with the current products available in Utah, probably about 1 in 10 individuals are at really high risk of a kratom use disorder. I'll leave it at that.
Thank you. Appreciate your comments.
Gail
ahead.
Rozika with Utah Eagle Forum.
Oh, sorry. Could we, Representative Peterson has a question. Could we, go ahead, Representative Peterson.
To the therapist. Sorry, over here. Question for you. I'm still learning about this kratom, but I've heard stories like you've just said that it creates an addiction, and I've heard other stories that it helps cure an addiction. And I'm wondering if you could address that from your professional standpoint.
Yeah, I think there are a number of individuals who are able to move away from other substances with kratom. And I really applaud and congratulate, their ability to do that. But I still think there are a significant number of individuals who will be crippled and disabled trying to use kratom to get off another substance.
Thank you. Go ahead.
Gail Rozika with Utah Eagle Forum. Many of you, and I think all of you, received invitations from us last week to attend a documentary on kratom. And I just wanted to quickly mention what went on in that documentary. It was not a documentary of propaganda, but it was a documentary of individual stories. Every single story was told by a mother, a father, a brother or sister of their family member who became addicted to kratom, thinking that they were taking a healthy substance that was going to help build their muscles and make them feel better after they've exercised. And in each story, their family member had died. And I always want to do a little show and tell today, because I have here just 3 products. I have lots I could show you that were purchased in the gas stations here in Utah. This one's called Donuts Kratom Extract Raspberry Jelly, something that would definitely appeal to children. This one's called Cryptic Kratom Extract, and that is, of course, the capsules that are filled with the kratom. But this one is called Crava Shot. And as we watched that documentary, this was the type that most of them had used. One mother said she found her son's nightstand, after he passed away, full of these little bottles. Each one of these are extract, and this is a pineapple orange Crava Shot. Thank you.
Thank you. Go ahead.
Ryan Nidell with Diversified Botanics. You'll see in front of you a potential leave behind for the members of the House that is supporting scientific data that will share facts around my testimony. Mr. Chairman, members of the committee, I'll be brief and stick to the facts to the best of my ability. There's been a large amount of theatrics around this situation, this conversation, and a lot of conjecture. My goal is to cut through that and just present the facts. It has been cited that there's been approximately 160 stated deaths that have kratom involved over the past 5 years. That is a 43% increase. What's not been told to you is that the vast majority of those deaths have involved fentanyl, methamphetamines, alcohol, and other drugs. The CDC has conducted their own level of research to show that 92% of kratom positive deaths consume multiple other lethal substances. When you correct for that, you're looking to 2 or 3 arbitratable deaths out of 3.4 million people, which is still too many, but a relatively small number. Now, if we consider the global context of this, over the same 5-year period in conversation, the kratom consumer base in the United States has grown from roughly 2 million consumers to 20 million consumers, a 10-fold increase. So if you look as a percentage growth, the industry is growing 10 times quicker than the amount of stated kratom involved deaths. The facts are not exactly what is being presented. This is not an epidemic. It's actually a declining rate in percentage deaths overall. There are more people consuming kratom now than ever before, with a lower percentage of them having any adverse effects. You've been told that kratom's a narcotic and is addictive, just like an opioid. That isn't exactly true. There's been multiple studies conducted by NIDA, by any number of regulatory bodies that have been governmentally funded to show that in an 8-factor analysis, which is the gold standard for determining the abuse potential of any consumable product, the kratom does not meet the standard for an 8-factor analysis to go through schedule 1, 2, or 3, meaning it's not stated to be harmful. This has been proven multiple times with more than 100 case studies. And in 2022, sharing from the Frontier for, don't want to misquote it, it's in the packet. I'll just make sure I don't misquote. So I know I'm at time, I can continue on, but even as we look at the conversation around 7-OH and the conversion, I think it's very important to state how this actually works. When you consume kratom, full spectrum, all present kratom, at best you have 30% bioavailability. That 30% bioavailability, your body metabolizes it as it processes through your body like everything else. A small percentage converts to 7-OH.
Thank you. Mr. Plum,
Mr. Chairman, I have 3 pictorial exhibits in the room.
can you bring that closer to you?
Mr. Chairman, I have 3 pictorial exhibits that I have with me, and I just wanted to know if I had permission to say Walter Plum from Drug Safe Utah.
I think we're gonna pass on that if that's
Okay.
okay.
So my kratom not only is addictive, but it affects other organs in the body, including the kidney, the liver, and the circulatory system. I have a daughter, my oldest daughter, about 54 years old. 4 years ago, 3.5 years ago, was told to use this as an energy booster, and she started in a tea form. It wasn't an extract, it was metragenine. She had pre-existing high blood pressure. Her blood pressure went to 180. I took her to the University of Utah Hospital. We met with the physician, and in the process of their interview, they asked her, "Are you using kratom?" She said, yes, she was using kratom. She was unable to stop. It resulted in a stroke and about 4 months of rehab at the University of Utah Hospital Center. This is dangerous. If you go into a gas station, it's marketed as just like 5-hour energy with no warnings about addiction or any of these other issues. This bill should be supported. Extracts should not be allowed in the state of Utah. Thank you.
Thank you. Okay, we had a question, Representative Wilcox, for the other gentleman. Thank you.
Thank you. Appreciate that. That was your name, Ryan, as well?
Yes.
Okay. Can you tell me, I got a couple questions actually, Mr. Chair. First one though, can you just tell us a little bit about your testing, what kind of the testing process you're going through?
Absolutely.
Yeah.
So we believe that the product should be tested not only when it arrives in our facility in Draper, Utah, where we have roughly 100 full-time employees, have been in business for 14 plus years and have generated in between 85 and 90 million in annualized revenue to add to the tax base in Utah. So we test rigorously when products land in our facility. We test for not only third-party contaminants, but also for the proper alkaloid profile that should be in naturally occurring kratom. Those products are quarantined and not able to be moved through our facility until the testing comes back from a validated third party, confirming the fact that there's no contaminants, no solvents, no lead, nothing that could be harmful to a human being, plus that it makes the standard alkaloid profile that should be found in naturally occurring kratom. As the product then moves through our production facility, when we pick it off the shelf to begin to turn it into a consumable good, when we blend products together, we retest them to confirm the fact that there's been no potential adulterant added to the process, because we do make both extracts and powder and capsule-based products. During that process, once that testing comes back as validated with no contaminants, no adulterants, then we go through our production process where we take inline retains at 5 bottles per hour, every hour we're producing, to confirm the fact that nothing's interacted with the product during that process. We're still not done with our testing protocol yet, because it's required that we then retain not only those for intra-production testing, but also finished good testing that has law codes that are validated end to end. So that product doesn't leave our facility until the final testing comes back from a third party yet once again for alkaloid profile, contaminants, anything that could be harmful to a human being.
So the testing primarily is focused on really what you're producing, I guess, here in Utah?
That's correct.
Where you're Draper at? Okay, so it's focused on that, but then it's also included, you said third-party testing. Can you tell me a little bit about what that is? Who's the third party?
Yeah, so we have used multiple different third-party arbiters before. We currently are using a combination of ARL as a third-party testing facility, as well as Cambria Analytics. Those take 2 to 3 days in transit to get product to those individuals. They're FDA registered third-party testing facilities for any type of consumable good. So they're running their own analysis on not only what's in the product, but also the alkaloid profiles and anything that could have entered into the product during production. So then that takes roughly 14 days between shipping the product to them, their 7-day process, because it takes time for it to cure, then for them to give us back the results, for us to take it off of quarantine hold and to make it available for retail sale.
Okay, thank you.
Okay, it looks like we have a spurred a couple other questions. Representative Peterson.
Thank you, Mr. Chair. Can you explain the difference from your perspective? And it may have been stated, I came in late, so I apologize. What the difference between kratom extract is and pure leaf kratom?
Absolutely. This is such a challenging conversation. We sell both. And I can appreciate the challenge that all of you would have to make sense of this, as I've been a part of our business for 6 years. And I'm just now really getting our hands wrapped around how it works. So kratom leaf is regional to Indonesia and Thailand. It grows on a tree. It's actually in the coffee family. If you look at where the origin of the plant is, it's very comparable to coffee. From the nature of that kratom leaf, depending on the age of the tree, the region of the world, and what's in the soil, when that leaf comes over and it's tested, we see as much as a 30% variance in the chemical composition of that leaf. We see heavy metals in some products. We see a vast array of alkaloid profiles, which the FDA does allow a 20% variance on label, but we hone it into the best of our ability without adulterating the product. So by the nature of that, leaf has 52 different components to it, alkaloids, subalkaloids, and metabolites as they're referred to. As we look at extract, all that happens during the extraction process in our facility is we take those leaves and we pull them down using food grade solvents to make a more, what would be deemed potent. We don't look at it as potent, we look at it as concentrated and pure product. The reason I say concentrated and pure is because during our extraction process, we can hone in that variance from a 30% variance to a sub 1% variance. So our product is incredibly consistent across the board. It has the same alkaloid profile as naturally occurring kratom leaf, but then has less variance from batch to batch or lot to lot. I think where the real issue becomes is not having a standard serving size across the board. If you want to take a concentrated extra strength Tylenol, I don't think that extra strength Tylenol would necessarily be bad, but it should have its own serving size associated with it. We believe inside of Diversified Botanics, there should be a standard serving size across the industry to allow a consumer to say, do I want to take 10 grams of leaf material, or do I want to take 2 droppers of an extract product? As long as the alkaloid profile would be consistent, I would make the argument that extract is a more consistent and predictable experience than leaf material.
Thank you, Representative Thurston.
Thank you. Are you familiar with Super K Extract Strong?
I am.
What is the standard recommended, whatever amount that a person should take of that?
Yes, absolutely. So Super K Extra Strong is our largest concentrated product by volume, right? So it's a 30 milliliter bottle that we produce. All of our product comes out of our facility. It has metered servings, so droppers that are associated with it, and has standard serving sizes of 25 milligrams of metragenine, no matter what product leaves. So inside Super K Extra Strong, a serving size we recommend is 25 milligrams, and 25 milligrams on Super K Extra Strong, if I recall, might be 2 droppers worth.
Okay, so would it surprise you to know that that looks an awful lot like a 24-hour energy shot and people might be drinking the whole bottle all at once?
Well, I would leave that up to interpretation. Our Super K Extra Strong product is sold behind the counter, very clearly is in a box that says 21 and over, is a purple based product, is in a glass bottle, and has a dropper on the top. So I don't know that someone would naturally confuse that with 5-Hour Energy. That's a small bottle that's plastic that's sold in front of the counter. If someone does, I wouldn't know exactly how to help solve that because we very clearly put 21 and over on every product and clearly have warnings of not to consume more than 150 milligrams of stated consumption in a 24-hour period.
Okay, so you think it's not safe to take more than 150 milligrams in a 24-hour period?
I think we would have to determine what safe ultimately means. And I'll refer to the single ascending dose study that the FDA conducted on kratom itself. During the single ascending dose study that the FDA conducted, which came to the marketplace in late 23, they did a single ascending dose study up to 12 grams of consumption of kratom. And 12 grams of consumption of kratom with a 1.25% metragenine content per volume, you end up with about 150 milligrams of metragenine in your body in one serving size. So what we've taken is a stance of saying if the FDA saw no adverse effects whatsoever in 12 grams of consumption, that it would stand within reason that if someone consumed that much in one day of extract product, they would also see no adverse effects. So to say safe versus an established metric for lack of harm as it pertains to the FDA single ascending dose study, it makes sense to us that 150 milligrams of consumption should be the max recommended in a day.
Okay, thank you, Mr. Chair.
Thank you. Thank you, Ryan.
You're welcome. Thank you.
Who is next? In the middle there? Okay, go ahead.
Hi, my name is Matt Acey. I represent a manufacturing company based out of Linden, Utah. And we manufacture products that contain kratom in it. My testimony here today is pretty simple. I am in support of this bill to an extent that we are allowed to continue manufacturing the products that we manufacture. As the way that the bill is currently stated, we will not be able to manufacture the products that we produce today. We represent about 100 employees, and we also represent nearly $100 million. Kratom represents about 40% of our business base. And if we are unable to produce here, we've already taken action to determine if we will leave the state along with the business that we have with us. So my ask of the committee today is that you table this conversation so we can agree upon what is the definition of kratom. What is the definition of kratom leaf? Because the way that it's proposed as of today, it would make my operation illegal. Thank you.
We have a question from the chair.
I'm sorry, where did you say your business is located?
We're based out of Linden, Utah.
Linden.
Yeah.
Okay, thank you.
Thank you. Go ahead, sir.
My name is Matt Caddo. I'm with the American Kratom Association. When I sat in your seat 45 years ago in this body, I heard a witness sitting in this seat say, if there's anything I say in the next couple of minutes that you don't agree with or don't think is correct, ask me. And I'm in that position because I don't have a lot of time. I can tell you first that there is no such thing as a legal product of a concentrate in hundreds of milligrams in the state of Utah because the current Kratom Consumer Protection Act bars it. You can only use food grade solvents which have limited extraction capability in order to produce the concentrated or extracts properly produced at under 100 milligrams. It just doesn't exist and it can be enforced. Secondly, 7-OH conversion, as been described in the liver, is vastly different with the natural plant. In small amounts, it does convert. When you take a 7-OH product, it's like hitting your liver with a freight train, and its significant impacts are different to the point that 7-OH manufacturers are now doing sublingual tablets and strips in order to bypass the liver entirely because they want to go right to your bloodstream. 7-OH is unstable. And so when a person dies, you're not going to detect it in a post-mortem investigation unless you do it rapidly, and that's the problem. There are KCPAs that are being enacted today in the United States, including in Wyoming. The Senate just passed it, not a ban, a KCPA. Nevada, Arizona, Colorado, and Oregon have already passed the KCPA, and I'm going to be in Idaho tomorrow testifying on a KCPA bill, so it's inaccurate to suggest that this material is not being done. Control this at the point of sale, not banning consumers in Utah who responsibly use kratom products.
Thank you. Go ahead, ma'am. You're up.
Hi, excuse me. Hi, my name is Laura Romney, and I'm here as a consumer. I'm a 9-year consumer of natural holy kratom for my facial nerve disease called trigeminal neuralgia. It's truly been life-changing for me. I'll tell you, it's been really hard for me to sit back here today. It's been very emotional because I've heard a lot of half-truths and a lot of things that have been twisted to make it sound like it's a fact. The one thing that was very alarming to me was the fact that they were saying there was no science behind this. I just last week was invited as a consumer advocate and to go to a symposium in Florida that was 3 straight days of the top scientists in the world that testified for 8 hours a day. And in fact, Nora Volko, the director of NIDA, was one of the presenters. She presented for 1 hour and she presented a ton of science and explained how safe natural kratom is in addition to actual extracts, which she used really high potent extracts in the science that she actually presented for the first time at that conference. So to say there's no science is absolutely untrue. Another thing I want to bring up is a lot of these deaths. There was one thing that was very much missing, the fact that there's never 7-OH that was brought up. If you notice, they said that the deaths had skyrocketed or whatever had gone up in 2024 and 25. That was the year when 7-OH became in existence. And so again, if you actually look at those deaths, just like Mr. Haddo said, you know, those deaths are 7-OH deaths. That is why they increase. And it's a very unstable element. And so it washes out of your body very quickly. And so what is left over is mitragynine. And so thereby you're there. And again, it's already been addressed how fentanyl has been the cause of like 96% of those deaths. So again, that was inaccurate. One thing to note too, that there was a Department of Agriculture employee that was actually at that 3-day science event. So he can actually tell you what he saw. But again, I just want to say that kratom has been life-changing for me. I don't want to go to a smoke shop to purchase it. There should be extracts available for patients that literally cannot take the leaf powder. They have things like Crohn's disease and they can't tolerate the actual powder. So for them, extracts are lifesavers, especially a lot of those that are coming off of hard drugs to use the extracts to taper down.
Thank you.
And I thank you again
It
for
looks
your,
like
for
we have
your
a
time.
question for you. if
Yeah, I
you'd
do.
like
Yes,
to stick
please.
around. Representative Thurston.
Thank you. Just can you tell me a little bit more about what it means to be a patient advocate? Is that a paid position? Do
No, no. So yeah. So I actually work full time as the treasurer, or I'm sorry, as the president of a nonprofit that does education. I have volunteered for the last, 10 years it's been 9
So-
years since I've been taking it. So
so
I
you-
volunteered for about
so
8
you-
years.
As a president of the nonprofit, you don't get paid or you?
No, I get paid a nominal thing, but I've only had that position for the last year because I wasn't before, but I've been volunteering for the last like 8 years with, doing a patient advocate. But the reason why I went is because I wanted to learn, because I teach people about kratom and teach localities all over the United States.
Okay, thank you.
Thanks.
Thank you. Okay,
Any other questions?
who is first? In the middle there? Okay, go ahead.
Hi, my name is Danny Bordeaux, and I'm an attorney, but I come here with a unique background, and I want to talk a little bit from a layperson's point of view. So my unique background is that I've worked for 3 different drug rehabs, and the interesting thing about addiction and a lot of these substances is, and what I also learned from watching the Kratom movie, is when you take Kratom, people testify, they feel like $1 million. It feels great. That is similar to all of the other drugs that people get addicted to. And so if somebody's going to get addicted to it, what usually happens is they start out with small amounts and then they start noticing that they're not getting the same impact. So they start taking a little bit more and a little bit more. And that's for people who are going to be addicted. That's what it feels like. There's never in their minds, especially something that's not labeled, that is not known to be harmful. They don't know. What was also interesting to me is I talked to a young person who struggles with addictions, who is in recovery right now. And I asked them, when I first heard about Kratom, I asked them, I said, do you know anything about Kratom? And they go, what's wrong with Kratom? And so those people know it's on the shelves. They know it's there. They know nothing about the dangers. Thank you.
Thank you. Go ahead.
I guess I'm next. My name is Judy Jepson. I live in Saratoga Springs. I appreciate your time. I know it's late in the evening and I appreciate the opportunity I have to talk about Kratom. I'm going to give you my personal experience with Kratom, and it actually involves my husband more than myself. He worked for Delta Airlines for 40 years. And most of those later years, he was involved in the luggage department. And at 62, he went out disabled. He had multiple surgeries, 2 back surgeries, neck surgery, carpal tunnel surgery, rotator cuff surgery, elbow surgery, and replacement of both of his knees. He was in constant pain. And as a disability, it meant that he could not sleep. He could not have any quality of life. He was introduced to Kratom after a relative of ours who had had a knee replacement, or excuse me, a hip replacement, introduced him to it. And he had been taking harder drugs up until the time he tried the Kratom. Kratom offered him the ability to not take any more of the opioids and other drugs that were giving him some help. He appreciated that opportunity and lived for a lot longer without the pain that he had been experiencing. My concern is that we enforce the purity standards, control the substances, because I don't want the 7-HO available, and make sure that the dosages are controlled, and also age verification, proper labeling and that sort of thing. I'm not willing to go to a smoke shop to purchase it though, and I think that that's the wrong venue to be able to allow people to access it.
Thank you for your comment. Looks like, oh, we have one question for you.
Mr. Vice Chair, if a smoke shop where it's regulated to make sure that only 21 and over can have access to it, if that's not the right place to sell it, where would the correct place be?
Excuse me?
You just made the comment that you said you do not want to go to a smoke shop to have to buy this. So if a smoke shop where it's regulated, where it requires you to have a proper ID, a valid ID, to be 21 and over to purchase it at the smoke shop.
What are the regulations on cigarettes at a grocery store? You still have to show ID. So why is it limited to just a smoke shop?
All right, yeah, sorry. During the committee, the questions during this part it comes from the representatives. So if you have an answer, that'd be great. We'd appreciate it.
Well, I'd like another alternative. I mean, do you regulate online purchases of certain things?
I got it. Okay. Thank
Is
you.
it possible to do a regulation but make it available online?
Sure. Okay. Thank you.
Thank you.
Thank you. Appreciate your comments.
Mhm.
Okay. We have a couple online. We're going to start with Joel Badger. Joel, if you could go ahead and turn your camera on and let us know your location.
My name is Joel Badger. I live in Lehigh, and I have a shop here. We're a Kratom shop. We're called Grow Kratom in Salt Lake. We're the only Kratom shop that I know of, and I am against this bill for a few reasons. This will require me to sell tobacco to sell Kratom. I think that's honestly absurd. I worry that smoke shops are actually the place where the people most at risk of addiction will be purchasing. A couple other points. I haven't seen any evidence that Kratom is being sold to kids from anybody in any of these meetings. I would really like to see that or have that discussed. Colorful packaging, I don't think is quite meets that requirement. If we're saying this is being sold to kids, I want to know if there have been arrests made. We've been extremely careful here. All the companies that I think we've kind of, like say Fill Free, we rejected them the first sample they sent us because they didn't tell us how much product was in it. They didn't tell us how much Kratom was in it. A shot like, say this Hush shot, by weight and volume has less metragenine than pure leaf kratom. That needs to be discussed. All that's happened with this is they've pulled out the fiber and they've added in a liquid instead. So 15 milliliters, which this is going to be less metragenine per milliliter than actual kratom is. Same with, these shots, these are kratom and kava shot. They tell you exactly how much is on them. This has about a teaspoon of kratom in it, but it's, 45, 60 milliliters. So I would just ask that we're kept in consideration here. We've been doing things correctly. We're not a big company. We've been around for 10 years. I really don't want to see kratom only sold in smoke shops here.
Okay, thank you, Joel. Appreciate that. We're gonna go to Marianne Christensen. Marianne, go ahead, turn your camera on and let us know your location.
Sorry about that. It took me just a little minute to get the permission, the panelist permission. I'm Marianne Christensen. I'm Executive Director of Utah Legislative Watch, and I'm speaking in favor of the bill. Contrary to what kratom producers are saying, every single testimony that I've seen of people who have lost family members to kratom and kratom addictions and kratom deaths, they've all been associated with just kratom, not kratom mixed with other drugs. I think it's very dangerous. It's viewed by our young adults like it's just another energy drink in concentrated form. And so it's being used by them in that way, and it's very, very dangerous. I think that it's closer to playing Russian roulette than it is to just taking an energy drink. So I supported the ban. I would love to see Utah ban it. And yes, people will buy it online, but at least we won't be making it available to people through our Utah law. So thank you very much. And we vote yes.
All right, thank you, Marianne. We're gonna go to Ryan Stolworthy. Ryan, go turn your camera on. Let us know your location if you're representing anyone. And this will be the last in public comment.
And I had originally intended to have Dr. Stolworthy as part of my presentation. He's an ER doc up in Logan, but he couldn't get on before. And now that I say that, he won't be able to get on.
Ryan, go ahead and turn your camera on and join the meeting.
I think he's Dr. Stolworthy, are you there?
It looks like he just declined to be a panelist. You have to accept to be a panelist if you get it next time it comes up.
Let's try it one more time, and then we'll move forward if not. And just as we're waiting to get him up, I just remind the committee that we do have a third substitute. I explained it before and I can explain it again.
All right, we're gonna move on. It seems like there's some technical difficulty there. We'll go to all right, we're gonna go ahead and close public comment and we'll bring it to the committee for action. Representative Thurston.
I move that we adopt the third substitute.
Is it the first substitute we want?
Third, number three. I want three.
Three, okay, three.
Yes.
Okay. Maybe I heard wrong. Okay, take that to okay, the motion is that we adopt the third substitute. Would you like to speak to that?
I would briefly. I actually think the third substitute is not, it's less than I want, but I understand that the senator has to get what he can get. So just so people know that I would actually prefer a stronger bill than the third substitute, but I think the third substitute puts us on a path in the right direction to be able to provide some balance between some access and some regulation. So with that, I appreciate the adoption of the third sub.
Okay, we'll take it as the committee for further discussion. We'll go to the sponsor for,
I support adopting the third substitute.
okay. And to the maker of the motion?
I'll waive.
Okay, the motion is that we adopt the third substitute of Senate Bill 45. All in favor, say aye.
Aye.
And those against? That passes unanimously. We'll take it back to the committee for further action. Representative Ivory.
Thank you, Mr. Chair. I'll make a motion that we pass out Senate Bill 45, third substitute with a favorable recommendation.
Would you like to speak to that?
Yeah, I would just briefly, looking up some of these things in the bills that we've had in front of us, FDA says there's no evidence of safe medical use, safety concerns remain. National Institutes of Health, research ongoing, pharmacologically complex, possibly promising. National Institutes of Drug Abuse, potential therapeutic compounds exist, but the risks are real. And they put it in the category of pharmacologically active compounds with cannabis, psychedelics, and herbal opioid substances. I just don't think that should be dispensed from a gas station or even a smoke shop. I think dosing and control, if I've got to go to a pharmacist and show my ID to get Sudafed to keep my nose from running, we've got people self-dosing and using this as medicine with hardly any control. And from medical professionals, we hear the risks and the deaths and the harm and the complications with other substances over and over and over again. I think this is a step. I think it's a good step. I think in talking to my colleague here, we're going to keep seeing more and more on this, and we need to get it right, but I think we need to take the step.
Okay, thank you. We'll go to the committee for further discussion. Representative Peterson.
Thank you, Mr. Chairman. I have three questions, if I could, that have come up as we went through the testimony. And I apologize if it may have been covered. I had to testify in a different committee, so I missed some of the testimony. But can you speak to how 7-OH, in several testimonies, it was discussed that it leaves the blood as you do blood tests on how people have passed away? Is that?
I'm actually going to phone a friend to make sure you get, I have medical examiner and Dr. Forsyth. Either of them can answer that question.
All of the data that I presented today was from testing for metragedine. We just recently started testing for 7-hydroxymetragedine late last fall. And so I don't have the data prepared for 7-hydroxy, or we don't have that data available to us yet.
But does it leave the body as was testified?
So metragedine is.
Sorry, can you two identify yourselves one more time?
Sorry.
Of course, I'm Megan Brockmeyer. I'm with the Utah Office of the Medical Examiner.
I'm Dr. Brandon Forsyth, Director of the Specialized Products Division at the Department of Agriculture and Food. So metragedine is converted in the liver to 7-hydroxy, but 7-hydroxy is actually very short-lived in the body, as was testified to. What they didn't say is it actually is converted to pseudoindoxyl, which is an even more potent form of a kratom alkaloid.
And you can test for that in an autopsy?
We can. We don't do autopsy tests at our laboratory. We test the products themselves, but we can identify it, yes.
We only test for metragedine and 7-hydroxymetragedine.
Okay. Sorry, that was one of my questions. Is there a safe level of kratom extract from your perspective?
That one for me?
Sure.
No. Not that there couldn't be a safe amount, as was testified to, you don't have to make a super concentrated extract. You can, but you can also make it very dilute. The bigger question is, should we? Like, is there reason to have these things on the shelf where people can take large amounts of it very easily? It's a very addictive substance, and people can start with a single dropper full and then they can graduate to kicking back multiple shots. It just seems like too big of a risk to me.
And to my third question, which goes to the good representative from West Valley? What, West Jordan?
West Jordan.
That's close. It was west. I feel like this may have a place, but if we pass this bill, does it effectively shut down manufacturing of this product that could be done in a different environment that maybe does have a more safe checks and balances on where it could be sold and purchased?
Let me respond to that. This would ban extracts, adulterations, and the synthetics. There's not a single manufacturer here that couldn't manufacture, produce, and sell pure kratom leaf. That's what this does. If they want to continue selling kratom in the state of Utah, it would need to be pure kratom leaf. They'd have to change their business model.
I guess my question though is, could they still manufacture it, just not sell it here in the state?
No.
Thank you, Chair Malloy.
I think I have the same question. We had testimony from two different businesses that I think they both said they had about 100 employees, so it's about 200 employees. Is this going to basically put them out of business, which is, I think, what their fear is? And then we also had the gentleman on the line who said he had a kratom store.
Yeah,
That's not a smoke shop.
Yeah, Mr. Chair, I would hope not, but any of these companies could produce pure kratom leaf. They could change their business model in the state of Utah. I work down in an area where there's lots of nutraceutical companies that manufacture a lot of different products, and companies evolve and they change. And certainly this would be a restriction, but as I've negotiated this bill with some of your House members, the goal was to preserve and protect pure kratom leaf, and they'd be able to do that.
Thank you.
Okay, thank you. We'll go to the sponsor on the motion, or just some.
Let me just read. I'll be really quick. I know this issue on extracts is going to continue to come forward, and I suspect it'll be an issue as it moves forward if this bill moves forward, and I appreciate that. I'm going to read just two labels from two products that are preferred vendors on the American Kratom Association's webpage. One is from Mint 45, one is from OPMS. One of them you saw, Mint 45, Super K Extra Strong. You've just found your strongest kratom shot, Super K Extra Strong. Every purple bottle features 1,250 milligrams of a broad spectrum extract. This shot contains a total of 1,250 milligrams of kratom extract with a total of 375 milligrams of metrogeny. I think the testimony from the experts today is that metrogeny converts into 7-OH, and that is very, very dangerous. Let me read a warning from OPMS. This is also a company prominently featured on the American Kratom Association's website. It says this is kratom extract, not raw leaf. The metrogeny and other alkaloid content in this product are multiple times greater than that of raw leaf, resulting in increased potency in extract product. As with all kratom products, do not use them without first consulting with a healthcare professional. Using metrogeny can be dangerous. There have been reports of adverse health effects associated with using kratom products. Some publications have suggested that kratom may be associated with serious potential side effects, including seizures, liver damage, withdrawal, addiction, abuse, and death. This product has not been evaluated by the Food and Drug Administration. These statements have not been evaluated by the Food and Drug Administration. This product has not been deemed fit for U.S. consumption by the FDA. That's directly from the website OPMS, which is a preferred vendor for the American Kratom Association. With that, I would urge support of the motion. Thank you.
Okay, thank you. We'll go back to the maker of the motion.
Just briefly. I think this bill makes it marginally safer. I want to be very clear. I don't think this makes it safe. I think it makes it marginally safer, and for that, it's a step. Encourage support of the motion.
Thank you. The motion is that we recommend favorably Senate Bill 45, third substitute. We'll go to a roll call vote.
Representatives Burton. Yes. Dunnigan. Ivory.
Yes.
Matthews.
Yes.
Wynn. Peterson. Roberts. Sawyer. Thurston. White. Chair Malloy. Chair Kyle.
Yes.
And Representative Ballard's online. I'm a yes.
Thank you.
Okay, the roll that passes unanimously. Thank you, Senator.
Thank you.
We'll entertain one final motion, Representative Peterson.
No, that was for the previous motion, but I guess I'll motion to adjourn now.
All right, motion to adjourn. All in favor, say aye. Aye.